So let's start. Are you ready to roll?
Yep.
We're all good.
Yep.
Okay. What's the impact of hospital log jams from a doctor's perspective? So when I'm in a hospital, how do I feel the impact of log jam?
The problem with hospital log jams is that they affect the quality of the care that doctors and nurses are able to provide to patients that are coming in with the most urgent needs. For you to call an ambulance, you're very worried about your healthcare and you want immediate healthcare. That's why you called the ambulance. And when people are ramped up outside a hospital, there's just no way that quality care can be delivered until they get in that front door. That's really frustrating for staff. Now, I gave you an answer there on ambulance ramping. I should probably give you a different one as well.
No, you'll keep going.
Yep.
So when that happens, what's going on inside emergency for the emergency physicians?
The problem in our hospitals is that they are full from the front door to the back door. And because we can't get all the people out of the hospital that we need to, because we haven't got enough beds in the hospital, one of the biggest pressure points is in that front door at the emergency department and at the elective surgery admission centre. People can't get in for elective surgery, and at that emergency department, care is not able to be delivered in the timely way that we'd like to do it and with a quality that all Australians expect from their public hospital system.
And then, of course, we've got the other challenge when hospitals are full of bed block, people stuck in beds, which is creating the logjam back down the hospital.
One of our long-standing issues in hospitals is that we haven't been able to get people who no longer need hospital care out of the hospital and into an aged care facility. That means that the beds that are needed for the really sick people are being used for people who should be elsewhere, and it just exacerbates the hospital logjam.
And then, of course, you end up with people that are waiting on elective surgery longer in the community, getting more serious injuries, which will mean they've got to end up calling the ambulance, and we're back where we started, right?
People languishing on elective surgery waiting lists are not just waiting for surgery, they're actually living with conditions that are continuing to worsen and that are affecting their quality of life, their ability to work, their ability to enjoy family life and other social activities. So people on elective waiting lists are not waiting for optional surgery, they're waiting for essential surgery that must be delivered in a timely way to keep Australians healthy.
You've done this before.
Once or twice.
Okay, let's go to what. So when we talk about planning for the future of public hospitals, what does that actually mean? What needs to happen for the hospitals to have the long-term funding they need to serve our communities?
What we need our governments to do is work together to solve these existing problems and, of course, the huge challenge of our future health needs as we continue to age and get sicker, living with chronic diseases. We need a new funding formula that allows our hospital system to grow to meet the community's needs whilst maintaining the highest possible quality of care that we can deliver. We also need to see proper investments in primary care, in general practice and in aged care to make sure that whatever conditions can be managed in the community are managed in the community, keeping our hospitals for those who really need them. And lastly, we also need to be investing in preventative health care. If we can stop people getting sick, we can of course protect our hospitals and keep them for the people who really need them. I said that twice, anyway.
Terrific. You're happy with all these, guys?
Yeah, great. Yeah.
We'll just keep reeling him off. It's like
Yep.
a machine.
Hey Peter, if you can just don't walk this off.
Sorry, mate.
Oh, I was just going to say, if you remember, just tap mute on your phone when Omar answers. Just 'cause,
Okay.
yeah, last night, just here a little bit. I can get rid of it.
Okay, I'll start doing that. So, Omar, one of the issues that people may not appreciate if we don't tell them is that all this talk of ending future lockdowns, that's really about ensuring that hospitals have the capacity to deal with outbreaks. Like, do you want to just sort of, in your own words, draw the link between the lockdowns we've had over the last couple of years and the capacity of hospitals to deal with black swan events?
One thing the pandemic has shown us so clearly is that our hospitals are running at 100% all the time. So when there's an extra demand due to a pandemic or due to even the seasonal flu or people injuring themselves a bit more because there's a new scooter available at Christmas time, any peak in demand is unable to be absorbed because the system is running on 100% activity all the time. The pandemic has shown us, I'll restart that. One of the reasons for lockdowns has been to protect our hospital system. If people with COVID can't be treated in a timely and safe way in hospitals, then clearly governments must act to limit the spread of the disease. And particularly in states like New South Wales, who are already defining their, I'm going to say that again, particularly in states like New South Wales, where the management of the pandemic is being very much linked to hospital capacity. The limitations in that capacity could mean that Australians are facing further lockdowns in the future.
And if you're comfortable, could we just do one line which is pretty simple? The best way we can protect against future lockdowns is to fund our hospitals for the future.
Yeah, that's kind of not true though, Peter.
Well, you're no fun. Right, don't do that if you're not comfortable.
Yeah.
What's your message to major political parties about public hospital funding?
Just give us one moment. We've got a funeral. Oh, that might have just been the time. No, we're all good. We're at, is it 4 o'clock? Not yet. Hope that's not going to be peeling for the next.
For whom the bell tolls.
Yeah, the casket is about to leave the church, so this could be going for a while. And it's starting to rain. I might just grab an umbrella and we'll come back to you, Peter.
Mate, the rest of it's green if we don't get any more. So, obviously, you've got previously about Medicare, but where's the linkage between supporting primary care GPs and keeping our hospitals operating in a way that we need them to?
Any political party that is a true friend of Medicare will realise that our health system is interconnected and it needs investment right across that system for it to work well. That means we need investment in prevention, we need investment in particular in general practice and primary care, because that is where we can prevent the need for very expensive hospital treatment, which we know is going to become an increasing challenge as our population ages and as we live with more chronic diseases. I'll give you another couple of lines just there, just in case you need them. I'll just expound on that a little bit.
Maybe if we segue into that public health and keeping our community, like a role of government is not hospitals, operating and the supply of people to get primary care, and then you've also prevented.
So that, Peter, the quality of your audio is not very good. I can't really hear what you're saying. Just dropping out every little bit.
Apologies. Can you hear me now? It's just, I think, a plane over.
Yeah, it sounds a bit better.
I just thought that with the GP piece, if you just went a couple of extra lines.
Yes.
Maybe just about keeping community safe and into preventative health as well.
Yeah, I'll give you a bit more on that. Yep. There's good evidence that investments in primary care, in general practice care, deliver better health outcomes for Australians and prevent Australians needing to end up in hospital. We know that general practice has been underfunded for decades, and general practice is under extraordinary pressure, of course, due to the pandemic. So an investment in general practice will also be an investment in protecting our hospitals and keeping Australians safer.
Yeah, perfect. And then it's finally made straight down the camera and mentions directly to the politicians and candidates the upcoming election, like, what are Australians looking for from people that, you know, want our support in leading the country?
Yep. In this election, Australians are going to have... No, I'll say it again. We believe that the pandemic has demonstrated Australians... we'll be yelling, sorry. The pandemic has demonstrated to Australians the importance of their health, and they have voted with their feet. I'll start that again. And a funny horn. Yep. The pandemic has demonstrated that Australians really value their healthcare. And as we go towards the election, it's critical that any party seeking to form government at the national level has strong health policies, that they will commit to looking after all of our healthcare through targeted investments in evidence-based healthcare. That means in preventative care, it means in general practice and primary care, and of course it means investing in our hospitals, clearing the hospital logjam and funding the future.
You'll probably have to do that one again.
Yep.
That's what I heard.
Yeah.
Did that one start right from... where shall I start from? I'm not going to be able to remember that. I'll just start again. You just use it all again. Yep.
Yeah, I started again. It was good.
The pandemic has demonstrated the value that Australians put on their health. It's important that any party wishing to form government at the national level after the upcoming election, that they have strong health policies and that they be held to account for those policies. We know that Australians will vote for the party that has a strong health platform, and a strong health platform means investing in general practice, it means investing in aged care, it means investing in preventative care, and critically it means investing in a future for our hospitals, a funding formula that delivers on Australians' needs and stops the blame game between our state and federal governments. We must end the hospital logjam, we must fund our future. What do you think of that one? Should I try that again?
And then,
Is that a bit long?
yeah, no, that was good, mate.
Yep.
The last one is to talk about that, you know, the one thing we've learned over the last...
Well before the pandemic, hospitals were in crisis. Ambulances were ramped outside hospitals and elective surgery waiting lists were unacceptably long. The pandemic has shown that these things get so much worse when the system is under any stress whatsoever. The solution is funding healthcare properly, funding Medicare to deliver for Australians. It is incredibly important that this is a key policy of any party wishing to form government, and our plea as an AMA to our politicians is to value healthcare, value investment in healthcare as the best investment you can make for the population, supporting our economy, supporting the lives of Australians, the quality of life of Australians. We must solve this crisis by investing now.
Yeah, I reckon that one more time, so you've done one a couple of bits.
Yep, I did. Well before, excuse me. Well before the start of this pandemic, Australian hospitals were in crisis. The pandemic has shown that any additional demand is unable to be dealt with by the hospitals. I'll just do that again, I paused too much there. Well before the pandemic, our hospitals were in crisis. Ambulances were ramped outside emergency departments and elective surgery waiting lists were simply too long. The pandemic has shown that any additional stress cannot be... Sorry, someone's got an interesting horn. Well before the pandemic... Are you right? Sorry, just picking you up there too. Well before the pandemic, Australian hospitals were in crisis. Ambulances were ramped outside emergency departments and elective surgery waiting lists were simply too long. The pandemic has shown there was no spare capacity in our hospitals, and the time for action is now. Our governments must work to solve the hospital funding crisis and to properly fund the rest of Medicare to make sure our health system works together and delivers for a healthy Australia.
That's terrific. I reckon you've given us more than been expected. Are you happy, Gavin?
Yeah.
And then we can talk about how we package